Does your knee feel weak or unstable, like it may buckle or give out on you? If so, this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what may cause your knee to feel unstable, how to know if it actually is structurally unstable, plus some things you can do to help improve your knee stability and prevent falls. Before we get started, it helps to understand what gives your knee structural stability in the first place. And there are a lot of really strong ligaments that surround your knee joint and give it stability. And those are the medial collateral ligament, or MCL, on the inner side of your knee, and the lateral collateral ligament on the outer side of your knee. The medial collateral ligament prevents your knee from buckling inwards too far, and the LCL, or lateral collateral ligament, prevents your knee from going outwards too far. Now, inside the knee joint itself, you have two ligaments that cross. They're called cruciate ligaments because of that cross-like orientation. And you have the ACL, or anterior cruciate ligament, and then the posterior cruciate ligament, or PCL. Now, what those ligaments do is they prevent your knee from hyperextending too far. They also prevent your femur or thigh bone from rolling off the back of your tibia as you go to bend your knee or squat. But there's another really important function of the two cruciate ligaments, is that they control the rotational stability of your lower leg. The ACL prevents your knee from twisting too far in that way, and the PCL prevents your knee from twisting too far that way. Now, additionally, you have menisci, or fibrocartilage, that surrounds the inner and outer sides of the knee, the medial meniscus and the lateral meniscus. And those kind of deepen the joint surface of the knee joint. Small meniscus tears usually don't give you very much instability, but if you have a larger meniscus tear, that can give you a little bit of instability in your knee. Now, finally, you have little ligaments on either side of your kneecap, the medial patellar retinaculum and the lateral patellar retinaculum, and they prevent your kneecap from going too far out one way or too far in the other way. So how can you tell if you actually have a structural instability of your knees? Well, if you've torn one of the ligaments in your knees or sprained it or stretched it really, really far, you actually can have a situation where your knee becomes structurally unstable. Now, the good news is, again, those ligaments are very, very strong. So you'd have to do something, probably a pretty traumatic injury like a sports injury or a fall, in order to injure one of those ligaments. And in that case, it's not just going to hurt when you put weight on it or feel like, ooh, that's a little bit unsteady. It's not going to hold your weight. Your knee's going to feel like it's going to buckle, or it might even cause you to fall if you put full weight on top of it. Now, if you are in the situation where you feel like you really just can't bear weight on your knee, it is important that you seek medical advice right away. A physician, particularly an orthopedic physician or a physical therapist, are probably the two best trained professionals to check the structural integrity of the ligaments in your knee joint to help you figure out if the ligaments have actually been overstretched or torn. And if your knee ligaments have been overstretched or torn, you're probably either going to need a pretty strong brace, particularly one that has bars on it that give you some pretty sound structural stability to the knee. And I'll put a link to such a brace in the description here. Or in really severe cases where you've torn the ligament completely, you may possibly require surgery. So if your knee is giving out on you when you're putting weight on it, it is important to seek out medical advice right away. Now, for most people, that's not the case. For most people who have instability in their knee, it's not actually structural instability, it just feels weak or unstable. So why would that happen? Well, your ligaments aren't just like strings that tie your joints together. They have receptors in there that tell your brain where your knee is in space. And if the knee slipped slightly out of alignment one way or the other, it's either gone too far to one side or the other, or it's twisted too far to one side or the other, that starts sending signals through those ligaments telling your brain, hey, the knee's at risk for injury. And so that feeling of instability, like it may give way, is actually a signal that, hey, you better do something about this before you actually do injure your ligaments. So that feeling is really to tell you, hey, it's time to pay attention to this. Now, one of the most common ways that people get that feeling of instability is rotational instability. And oftentimes that comes from overpronating, your knee going inwards when you're walking. And as you can see from that motion pattern, that puts a lot of stress on your medial collateral ligament. It also kind of twists on the menisci inside the joint, and it puts some strain on your ligaments, your cruciate ligaments inside the knee. Now, what happens when you overpronate or your knee goes inwards too far is you get internal rotation of your femur and external rotation of your tibia. So you're going in a movement like this. And if your knee gets slightly out of alignment, then you may start to lack that internal rotation of your lower leg or of your tibia. And that can make you feel a little bit unstable on your feet. Additionally, the tibia may slide one way or the other and make you feel a little bit unstable. So here are some tips you can use to help improve the knee stability and get that line back up so you start to feel better right away. So here's how you do that. You'll sit down in a chair, and for the first exercise or mobilization, you want to cross your leg over. Ideally, you want to try to get it down as far as you can, but if you can only go this far, that's okay. And what you're going to do is take the opposite hand and wrap it around your lower leg bone close to the joint line. So you wrap it around your tibia or lower leg bone close to the joint line, kind of hook around it like that, and then put your other hand up here. So you're applying an outward pressure with your top hand and an inward pressure with your bottom hand. So what you're doing is you're sort of rotating the tibia inwards while also translating it a little bit inwards. And what that does is help realign the joint surface. If you're pronating a lot like that when you're walking, it's just basically undoing that movement pattern. So again, hooking here and kind of pulling into rotation and pushing out there. And you can do this as a sustained hold, or you can kind of go back and forth. But in general, do this for about a minute or so. Now, after you've restored the passive internal rotation of your knee, next you want to be able to use your muscles to help do that actively. There's not a whole lot of muscles that directly internally rotate your knee, but there is one tiny one that helps unlock your knee when you're going from a fully straightened position while walking into a bent position. And that's a little muscle that runs across the back of your knee called the popliteus. And that muscle helps internally rotate your tibia. Additionally, your inner hamstring attaches right on the back of the inside of the knee. And so you can use the hamstring, particularly the inner hamstring, the semitendinosus and the semimembranosus, to help internally rotate your knee as well. And so an exercise to help do that is to sit with your knee bent about 90 degrees. Think about turning your foot inwards, and that kind of cues your popliteus to turn on. Then bend your knee, and when you bend your knee with the lower leg internally rotated, you activate the inner hamstrings a little bit more than the outer hamstrings. And so you turn the foot inwards and then bend the knee like that to activate your hamstrings. You do that for 10 or 15 repetitions. Just kind of going back and forth with the knee bending while holding the foot inwards in a position of tibial internal rotation. Now, after you've done those two things, you need to be able to control that motion and keep your tibia from going into too much external rotation while you're walking. And in order to do that, you need to stop the thing that caused it in the first place, which is overpronating. So if you're in the habit of walking where your foot flattens out and your knee goes inwards, the biggest things that cause that are weakness in your hip muscles, the hip external rotators, and letting your arch fall. So weakness in the foot muscles that help control your arch. And so the best way to help improve that is just to practice standing on one leg. You want to start by doming your arch here, turning the knee out. See that from a different view. Going like that. And then practicing standing on one leg while holding that arch lifted. You may need to hold on to something for balance initially, and then as you get better at it, you can let up and just practice balancing. Begin to see a side view. Lift the arch, hold on for balance as needed. And so that's the third exercise. Now, what about front to back stability? If you feel like your knee is going to buckle or bend that way. Well, one of the most common reasons that people feel like their knee is going to buckle or bend is that if you don't get a full knee extension where your two cruciate ligaments, your ACL and PCL, kind of cross when you're in full knee extension, then you're having to use your muscles throughout your walking cycle to maintain the stability of your knee. Now, ideally, you want those two cruciate ligaments to kind of lock your knee in extension so that you don't need to use muscle force in order to keep your knee stability as you're going to take a step. But if you lack full knee extension, then you may not be getting to that point where you get that screw home mechanism, which locks your knee in a stable position. And so it's really important to get as much knee extension as you're able to. Now, granted, if you have really bad knee arthritis, you may not be able to get it completely 100% straight. But you want to try to get it as straight as you're able to. And a good exercise to do that is something just called a terminal knee extension. This is where you practice squeezing your thigh muscles, so tightening the thigh muscles like that, and putting your knee in a straightened position. So you put one foot forward, the foot you're working on is in back because you're going to be stepping forwards while on that leg. And then just think about going from a slightly unlocked position to a locked position. Unlock, lock, unlock, lock. So that's an exercise to help with front to back knee stability. Now, one other thing that we haven't talked about yet is the kneecap stability. The things we've talked about so far are for the patellofemoral joint, where the knee actually bends. But there is a joint between your kneecap and your thigh, and if you've either injured those ligaments on the side of the kneecap, or if you go too far into a pronation movement and your kneecap tends to dislocate out to the side, there are things that you can do to help improve the stability there as well. First and foremost, that exercise we already talked about, balancing on one leg and preventing that overpronation, is probably one of the most important things. But some people are naturally born with a shallower groove where your kneecap runs, and they can be more prone to having their kneecap kind of slip out of place. And in that case, there are braces that you can wear that has a hole where your kneecap sits and also kind of a pad on the outside to help keep that kneecap from sliding to the outer side that way. So if you feel like your kneecap is popping out of place and that's giving you that feeling of instability, like your So if you feel like your kneecap is popping out of place and that gives you the feeling of instability, like your knee may give out on you, then wearing one of those patellofemoral support braces is an option that may help you. Now, I've got an additional video that gives information about a knee that pops, that gives more information about what to do for a kneecap that feels like it's going to pop out of place. And I'll link to that here in just a couple of seconds. But just to summarize, if you are having a knee that's feeling unstable, whether it's actually unstable structurally or whether it just feels a little bit unstable, it is probably a good idea to get it checked out so you can figure out what's causing it, fix it, and keep it from getting worse before you do get in the situation where you potentially fall. Now, if you are in the St. Louis area and you need some help for knee instability, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else but you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.